Section 2 reviews what urgent threats are as represented in the CDC Antimicrobial Resistance Threats Report and the implication of these urgent threats to our patients. This particular report, Antibiotic Resistance Threats in the United States, 2013, was CDC's attempt to prioritize the threats that we're seeing in terms of antimicrobial resistance. And so the triage is urgent being the highest priority, serious and concerning being lower priority threats. Clostridium difficile, or C. diff, is a problem that many of you probably are familiar with. It's a real scourge in our communities, very difficult infection to get control of. CDC estimates that we're seeing about 250,000 infections a year, 14,000 fatalities, and about $1 billion in excess medical costs per year. So this is a very serious concern, and it is an indicator of a lack of antimicrobial stewardship in a community. So if you have problems in your community with a lot of C. diff outbreaks, then you really want to get with your local public health officials and other healthcare facility partners together around the same table and discuss how you can implement antimicrobial stewardship at the community level. And we'll talk about that in future sections of this training course. One of the challenges with C. diff is that it is a spore-forming bacteria, which means it can spread very efficiently from patient to patient. So if you have a patient inside your facility with C. diff, they can potentially transmit it to other patients and cause outbreaks inside your facility. It is the direct result of patients who received broad-spectrum antibiotics as well as prolonged antibiotic care, oftentimes was inappropriate to begin with. We've seen that the so-called virulence or pathogenicity of this bacteria has increased over time. And so C. diff related deaths have increased 400% since 2000. And it's because of increase in the development of resistance to many different classes of antibiotics. So C. diff is very difficult to treat. It's a significant cause of morbidity and mortality in the United States. Carbapenem-resistant Enterobacteriaceae is another category of urgent threat that is related to antimicrobial resistance. In this case, carbapenems are considered the end-of-line class of antibiotics that are typically used to treat gram-negative infections. This is a very important trend that we're seeing. It's very scary. And so the numbers that you're seeing here on this slide are relatively low compared to C. diff. However, this is an emerging problem, so it's likely going to get worse before it gets better. One word of caution, when we're talking about CREs, we often focus on the name that says that they are resistant to carbapenems. Really what we see on the culture and sensitivity results is these bacteria often are either extremely drug resistant, where we're down to 2 classes of drugs left to treat these patients, or they appear to be pan-resistant, meaning that every single class of antibiotics that we've tested the bacteria against appears to be exhibiting resistance. So we have to be very, very careful with these patients. A lot of times we also find out that they happen to also be resistant to polymyxin B or colistin, which is the true end-of-line therapy for these patients. So this is a scary trend. It's something to keep an eye on, and certainly something to be aware of in the coming years. Drug-resistant gonorrhea is also an emerging public health issue. We're discovering that it's becoming harder and harder to treat gonorrhea, and that's an issue because we've seen dramatic increases in the incidence of sexually transmitted diseases here in the United States over the last 25 years. And so this too is another key priority threat that we need to keep our eye on. One of the key issues with antibiotic-resistant gonorrhea is the resistance to third-generation cephalosporins. The bottom line is we're running out of options to treat gonorrhea, and it is related to the broader community overuse of antibiotics, the inappropriate use of antibiotics. So again, the ripple effect of overusing antibiotics writ large is that we run into problems in other areas of medicine, such as sexually transmitted disease like gonorrhea. So we encourage you to read the antibiotic resistance threats report in full and be aware that it's going to be updated here coming soon in 2019. And again, the purpose of the report is to help bring a little bit of context and a big picture view into the urgent threats that are facing us in antibiotic resistance.